Hello everyone, I'm Dr. Gargi Raigaswamy. Today we will talk about and discuss on fluorides. You have heard about this mineral many times because they are present in many food and particularly in toothpaste. So let me give you a clear idea about what fluoride is and how it works and whether it is necessary for our teeth or not, and also for our overall health. So let's find out all about fluorides today. So first question that comes to our mind is, what is fluoride? To answer this question, I can just tell you that fluoride is a naturally occurring compound that can prevent dental decay. And this fluoride ion comes from elemental fluorine. As we all know, that fluorine is an abundant element in the Earth's crust in the form of fluoride ion. But it does not occur free in nature. It exists only in combination with other elements as fluoride compound. Also, fluoride compounds are components of minerals in rocks and soil. So what happens, like when we tell that yes, fluoride is there naturally in several water sources like lakes, rivers and streams, but though in very small level. So what happens, since the rocks and soil have fluoride in them, water passes over the rocks and these fluoride compounds starts dissolving in this water and they release fluoride ions. Thus, the result is small amounts of fluoride which are present in all water sources. Fluoride is naturally present to some extent in all food and beverages, but the concentrations vary widely. Fine. So the next question would be, what does fluoride do? Related to our teeth we are talking about. Fluoride is said to protect the teeth in two ways. So first is protection from demineralization. What I mean by these is like when bacteria in the mouth combine with sugars that they get from the food that we eat, they produce acid. Now, the dental decay process is nothing but the erosion of tooth enamel or damage of tooth enamel due to this production of the acid. Fluoride actually protects teeth from demineralization, which has been caused by the acid produced from the interaction of bacteria and sugars. Second, fluoride also helps in remineralization. Suppose if there is already some damage that has been occurred to the teeth has been caused by the acid, fluoride accumulates in the demineralized areas and begins to make the enamel stronger, and this process is called remineralization. If you want to know about the mechanism, just for your knowledge, what happens is like altering the structure of the developing enamel. Uh, it happens so that it is more resistant to acid attack. This happens. The fluoride disrupts the process of tooth decay in this way. So these structural changes occurs as the child's enamel develops before even he is say 6 to 7 years old. Not only that, the fluoride also provide an environment where better quality enamel is formed, which is much more resistant to acid attack. Also, it reduces the bacteria's ability to produce acid, which is a major cause of tooth decay. Fine. So, how does fluoride help in to prevent dental decay? Let us find out that. Again, fluoride, we already have known the mechanism now. So, fluoride acts in two ways, systemically and topically. Systemic means whatever is ingested inside the body, and whatever ingested fluorides are being used or incorporated in the tooth structures during the tooth formation. Also, the systemic fluorides has a topical protection because whatever fluoride that goes inside our body, that is systemic fluoride, is present in saliva, and teeth are always continuously bathed in saliva. So saliva is a very good source of fluoride, and thus it also helps in to prevent the dental decay. The common sources of systemic fluoride is the fluoridated water that we get from the water supply. Then there are certain dietary fluoride supplements in the form of tablets, and then lozenges, drops, and there are also many foods and beverages where fluoride is present. Um, when we talk about fluoride, we always relate it to children. Not only that, fluoride, topical fluoride can strengthen teeth already present in the mouth. That is, after the teeth is formed in the mouth. That is, when you are adult, even topical fluorides can are good option to prevent the further decay of your tooth. So topical fluorides can be in the form of toothpaste, mouth rinses, or also when we dentists apply professionally fluoride foams, gels, and varnishes depending on the condition. Now, the community supply or public water supply is one of the best source where fluoride comes in. So, uh, the question is how much fluoride is in our water? To find out that, we can always contact the local water supplier or the local or country or state health department. So as of now, the rough water safety limits of for in context of India, it's about 1 mg per liter. If you are interested to find out the pros and cons of water fluoridation in India, you can visit the site www.indiawaterportal.org and you will get more information in the similar context. Now let us understand, do adults benefit from the fluoridation? Yes. Fluoridation plays an important protective role against dental decay throughout life, benefiting both children and adults. In fact, inadequate exposure to fluoride places children and adults in high risk category for dental decay. And okay, so our another important aspect on which I want to throw light is nowadays we have seen or we are used to drink bottled water more rather than using the natural sources of water and the community water. Even we make a habit of our children to do that. Now, have you ever thought that whether the consistent use of such bottled water result in individuals missing the benefits of optimally fluoridated water? Yes. Why? Because the bottled water that are in the market do not contain optimal levels of fluoride which is required. Individuals who drink bottled water as a primary source of water could be missing the decay preventive effects of optimally fluoridated water available from their community water supply. Fine. So, what or how much fluoride should an individual consume each day to reduce the occurrence of dental decay? Now the answer is the appropriate amount of daily fluoride intake varies with age and body weight. As with other nutrients, fluoride is safe and effective when used and consumed properly. And the very common question is like there are many misinterpretations though regarding the community water fluoridation that whether fluoride is a toxic substance. No, absolutely not. Fluoride that is found, the concentrations of fluoride, the optimal concentrations that are present in the community water is not at all toxic. So there are immense scientific acceptance, scientific knowledge regarding this. Now coming to what are the benefits of fluoride being in the toothpaste. All toothpaste, whatever be the brand and whatever your advertiser shows off about the product, the main purpose of all toothpaste is to remove plaque that is a film of bacteria that forms on the teeth and gums every day. So when you brush with the toothpaste, that plaque goes off. This plaque can cause gum disease and also it aggravates tooth decay process. So, in addition to helping removing the plaque, fluoride toothpaste provides an extra benefit in preventing tooth decay by making tooth enamel stronger. That's why A fluoridated toothpaste is always advisable by the dentist to be used for brushing. Now, what about children? Do children should also use fluoride toothpaste? Definitely. But there are certain recommendations regarding that. For children younger than 3 years, parents or the caregivers should begin the children's brushing the teeth of the children, and it shouldn't be the amount of paste that should be used shouldn't exceed more than the size of a grain of a rice. It should be very nominal for children younger than 3 years. And also, you should use toothpaste which are meant for kids, because again the reason is the fluoride content of the kids toothpaste is not similar to that of ours which we use. So for children to 3 to 6 years of age, you have to see not to dispense the toothpaste more than a size of a pea. That's important. And definitely, as directed by your dentist or physician, the teeth should be brushed twice thoroughly. And children's brushing should be always supervised by the parents or caregivers to so that they use the appropriate amount of toothpaste. That is very important. So many parents or many people come and tell me that the child doesn't brush. Child will not brush because that is a small kid, so you have to take care of, and you have to see that whether they shouldn't ingest the toothpaste quite often, because then they are taking a quite good amount of fluoride. you know yeah. So now the question is, who needs fluoride? So virtually, if we talk like that, virtually all public health authorities and medical associations worldwide recommend that children and adults receive a minimum level of fluoride. Definitely. So children need fluoride to protect their permanent teeth as they are being formed. Even adults also need fluoride to protect their teeth from getting decayed. Several people, especially those at higher risk of tooth decay, benefit from fluoride treatment. Uh, just to give you a list, individuals who have poor dental hygiene, more snacking habits, persons who do not have or little access to a dentist, medically compromised children or persons, adults, diets that are high in sugars or carbohydrates, individuals who have undergone many dental procedures and they have bridges, crowns, or braces, or other restorations in the mouth. Also, if you have a history of tooth decay, that is your dental cavity. So these are the people, so practically all people, and these are the more vulnerable people to get tooth decay, and they definitely need the fluoride coverage. Now, we also know that nothing excess is good. So, excess fluoride has many health problems associated with it. So, let me tell you, just give you an idea where this excess fluoride exposure may come from. The first is public water fluoridation. Yes, if it is not monitored and you just consume that way, so you might land up in consuming very high amount of fluoride. Also, uh, fluoridated mouth rinse or the toothpaste, because children, as I was telling, children may swallow it. Untested bottled water. Also, inappropriate use of fluoride supplements and some foods. I'll talk about a condition called dental fluorosis. Here, when this dental fluorosis occurs when excessive exposure to high concentrations of fluoride during tooth development or during childhood causes tiny white streaks or specks in enamel of the tooth when the case is mild. In severe cases of dental fluorosis, you may find that the tooth has definite discoloration and brown markings. Even the enamel may become very rough and give you a pitted look, and it's very difficult to clean. And the spots and Stains that are formed, they're permanent and they may eventually darken. Of greatest concern is the aesthetic changes that occur in permanent teeth among children who are exposed to too much of fluorine between the ages of 20 and 30 months. Okay, so according to the dental associations, or the critical period for fluoride exposure is between 1 and 4 years of age. The risk goes away absolutely almost after the age of 8 years. Symptoms the severity again depend on several factors. It will include child's weight, age, weight, bone growth, diet, etc. Another important condition that is uh, that is of much concern that occurs due to excessive intake of fluoride is skeletal fluorosis. It is a bone disease that is caused by too much of fluoride. In severe cases, there is damage to bones and joints as well as pain. High fluorine concentrations in the body lead to hardened and less elastic bones, and thus the persons the bones of such persons are more prone to fractures. So I think I could have given you an overall overview about fluoride and its sources and how important it is in preventing your dental cavity. Also, the detrimental effects of excess fluoride. I would love to answer any of your queries. So if you like my video, give your suggestions, and also if you have any question, please do write in the comments. Thank you for watching. Have a good day.